How does a Botox brow lift actually work? Let's break it down. To really understand how a brow lift works, we have to understand the anatomy. The orbicularis oculi muscle is the primary muscle around the eye. It's a circular muscle that goes around the eye, and it's primarily involved in eyelid closure, squinting, blinking, and allowing for that natural eye expression. Now, the orbicularis oculi is divided into three portions. We have the outermost portion, which is called the orbital portion. This area is involved in eyelid closure and brow depression. As we move more centrally, the middle part is called the preceptal portion. The preceptal portion is involved in a little bit of gentle eyelid closure, but also blinking. And then closest to the lash line, we have the pretarsal portion. This portion is involved in blinking, but it's also part of the lacrimal pump that allows us to drain our tears. So it's not, when we're thinking of the orbicularis oculi, it's not just one muscle doing everything. It's really these three working together to allow for that eyelid closure, brow depression, and blinking. For a brow lift, we're really targeting that orbital section that is involved in brow depression. So by relaxing this function, you get a little bit of a brow lift because what happens is you relax that downward pull. But think about the function of the frontalis. The frontalis is the only elevator of the eyebrows. So when we relax this muscle that naturally wants to pull down the tail of the brow, you naturally get a lift in the brow, and it allows the frontalis fibers to help as well, lifting the brow even more. Now, what becomes a little bit of a concern or a little bit of a challenge is when your patient wants a full frontalis dose. If we tox our frontalis, we're naturally going to get that downward effect on the frontalis, right? We're opposing that function. So I oftentimes have to have conversations with my patients where if we're dosing your frontalis to the point of freezing it, which is a preference, then unfortunately we're not going to get as much of a brow lift as we would love because we are creating a downward effect on that frontalis or on those brows, and that brow lift can't really do what it wants to do. So oftentimes I'm telling patients what we need to do is create a little bit of natural movement, a little bit of space for the brows to elevate. And by giving that natural movement or allowing that space, you can get a nice brow lift. But a frozen forehead will typically block that brow lift from happening because there's no room. It's counteracting that brow lift. So oftentimes you have to have those hard conversations with your patients. We either want a little natural movement to give room for the brow lift, or you can have a frozen forehead, but naturally you're not going to have this dramatic brow lift or arched brow. Sometimes patients can have the best of both worlds, sometimes they can't. It really depends on your patient's unique anatomy. When it comes to a male, I typically don't offer a brow lift. I think by aesthetic guidelines, a male brow is more flat, right? Unless they come in with very heavy eyelid hooding or a low sitting brow, then I may give them a brow lift just because they're on the extreme. They're heavy, they're hooded. I want to take a little bit of pressure off of that brow or off of that eyelid. So I may offer it to them. But typically, if a more youthful male comes in, I'm not offering a brow lift. I'll gently treat their crow's feet, but I'll skip taking that pressure off because an arched brow is definitely more of a feminine look. So how do I perform this brow lift? I typically offer my patients 5 units per brow for a total of 10 units for a brow lift. How I perform this on examination, I have them squint really, really hard and I look for that downward pull of that orbital section of the orbicularis oculi. So I look for these diagonal lines that you can typically see when they squint really, really hard, and that's where I'm injecting. Typically that falls in the hairy brow itself. So I'll inject 2.5 units in the tail of the brow to really elevate the tail of the brow. I typically don't sit below the orbital rim. I like to be either on the orbital rim or a little bit superior to that. But you have to be mindful. Remember that frontalis fibers are blending with the orbicularis oculi fibers. So you want to make sure that you're not riding too superior and hitting those frontalis fibers, naturally weighing down that brow. That's what we're trying to avoid by offering them a brow lift. Sometimes what can happen is a patient comes in with a natural asymmetry. Maybe one brow sits a little higher, one sits a little lower. So naturally, I'm not going to inject this brow that naturally sits higher. I'm going to inject this one to hopefully give them a little bit more symmetry. When it comes to a brow lift, sometimes when you treat both of them symmetrically, it can come in. The result can present asymmetrically. It's all about fine tuning your treatment. I tell every new patient that I inject with neurotoxin, give me one treatment where you're not completely satisfied. I have to learn how your frontalis, your muscles, your anatomy responds to X dose. So I always treat conservatively the first time, and then we build once I master their anatomy and how they respond, then we can master their dose. But always to ease a little bit of that uncertainty, because it doesn't matter how experienced you are, neurotoxin still stumps even the most experienced providers. I think the more experience we have, the more confident we are in telling our patients, this is my first time treating your particular anatomy, so I'm going to lean more conservatively, under treat you ever so slightly, and then we can tweak as we go. But I'd rather be in that position than in a position where I overdose you, you're walking around with heavy brows and you hate it and we can't take it away. So really sit confidently in understanding that we are human beings and we don't have a microscope under their skin. We don't know how their muscles are going to respond. They can look like they can tolerate, maybe they have a tall forehead and they look like they could tolerate a larger dose of neurotoxin, but maybe that might be tall forehead, but it's a weak frontalis. You don't know. So always undertreat the patient the first time you're treating them. Explain what the risks are, talk to your patients, but always look at their unique anatomy to really determine what's best for them and not just blanket injection technique pattern them like what we learn in the textbook. Every patient that sits in my chair gets a different dose, gets a different pattern. I'm truly looking at their unique anatomy. But a brow lift is such a beautiful, subtle, just pop of brightness to our patients. I love a brow lift. I do a brow lift every time. And for me personally, I love a little bit of natural movement in my frontalis so that I know that I can get a more exaggerated brow lift. I rather a bright brow than a frozen forehead. And for me, as I'm aging, I'm having to choose one or the other. I can't be frozen anymore without weighing those brows down. So really humanize the experience. Talk to your patients about what potentially could happen. And if you're running with or if a patient is presenting with really heavy eyelid hooding, sometimes the conversation is, unfortunately, we can no longer treat your frontalis without worrying about weighing your brows down. So canceling that treatment altogether and just focusing on a little glabella, a little in the crow's feet, and a brow lift can sometimes be exactly what they need. Hope this helps. If you have any other topics that you want me to talk about, please comment below. And if you're loving these videos, please hit that subscribe button.